is time for your community focus, and today we're joined with Gary Regan of Lifespan. He's going to talk to us about a program for youth and those who may be at risk for self-harm or maybe even suffering for anxiety. Gary, thank you so much for joining us today.
Thank you for having me.
Awesome. Thanks for being here. So there is this program right now at Bradley Hospital. It's called SafeQuest. It helps to address some of those concerns that I just talked about. And the new thing about this program, it's been around, but now it's also being offered virtually. So can you just talk to the people at home, those parents that are watching this, about what this program is?
Sure. So SafeQuest has been around for about 18 to 20 years right now at Bradley. Pre-COVID, it was a fully in-person program, but due to the onset of COVID, all of the adolescent programs went to a virtual model. So when COVID started settling specific to this program, we kept it virtual because we were finding it was more helpful for the teenagers and actually reducing some stress because they didn't have to worry about, being in school all day and then having to come here for another 3 or 4 hours. So we were able to go home from school and debrief a little bit and then start the program after that.
And this program, what exactly happens when students go to this after-school program? Like, how does it work?
So everybody signs on at 3 o'clock. We do a quick activity, learning opportunities, checking in with the teenagers. They have a group therapy session at 4 o'clock. They then do another therapeutic type of activity at 5. And then during the course of the week, they have family therapy, individual therapy, and they have access to a psychiatrist or clinical nurse specialist for anything medication related.
And that has to be helpful. I mean, everybody at this point has been impacted by the pandemic in some way, whether that's physically, emotionally, mentally. And just talk to me about what you've seen and how this has played a role in kids and youth, adolescents, their mental health.
Yeah, I think throughout the entire state, we've seen a significant increase with the number of teens, children, families, even adults who have needed extra supports and services. And unfortunately, there's just not a lot of providers that are out there. We've also seen a lot of providers leaving the field or, retiring early or changing their own habits in terms of what they're doing for working with teens. So we've also, because now that we've had more teenagers and more children in need with less providers, there's just a lot more of a backlog of being able to provide services. So what we've tried to do is expand our services and make them more available as much as we possibly can to try to meet some part of that need.
And for those who maybe need help but don't really want to ask for it, what would be your advice to them?
I think the biggest thing is you said you don't want to ask. There's always somebody out there who is willing to help. Try to utilize your parents as a resource. Go to a teacher, go to a guidance counselor, somebody that you trust, and just have faith that there is somebody out there who can help you with whatever you're struggling with. And reach out. Give us a call. I'm always willing to take phone calls and talk to people over the phone. We have what we call Kids Link here at Bradley Hospital. It's a statewide phone number so people can call in and get guidance. Either parents can call in, teens can call in, get guidance, get support, get a list of resources if necessary.
And just before I let you go here, for parents, what are the tools they can use? What can they do to help support their children or youth that they may know that are battling these mental health issues or anxiety?
So for me, when I do family therapy, the biggest thing I say is just listen to your teens. Don't try to give them too much advice. Try not to nag them. Just actively listen in terms of what they're listening to, and don't minimize what they're experienced with. Try not to relate too much like, oh, when I was a teenager, this is what I went through. Just listen, and then if they're looking for help find them find those resources so that they can get the help that they need.
Important tips. Thank you so much, Gary, for joining us today.
No, thank you for having me. I had a great time.
Absolutely. And we want to look ahead to tomorrow when Rhode Island EMA Director Mark Pappas is joining us to discuss hurricane preparedness. That's going to happen tomorrow in our Community Focus.